Hello everyone, Dr. Kimball here. I am talking today about how to heal or fix your bulging disc. This is part 4 of a 7-part exciting series. I'm sure you're waiting for that secret sauce that I'm going to tell you, and you're just waiting for it to come. Today I'm going to be talking to you a little bit about reducing inflammation, anti-inflammatory medication, injections, and how those relate to healing or fixing your bulging disc. So, I'm presuming you've watched the other videos. If you haven't, go back and do it, because the premise of this discussion is that there's not a tremendous amount that you, or positioning or maneuvers that you can do, in my opinion, to actually heal your disc. That once there's a tear, once there's a bulge, there's been some biological fabric in your spine that has sustained an injury, that injury can heal a little bit, but there's not a lot that you can really do about it to get rid of your pain, okay? You can do some of the things that I'm kind of mentioning to you. One of the things, at least in the beginning, is to try to reduce the inflammation that occurs when an injury happens. And there's a lot of scientific literature that is available that would support at least a minimum of 3 months of anti-inflammatory treatment for pain related to a disc, your back, or a nerve impingement. And that really needs to happen in pretty much any and every scenario, not every scenario, most scenarios of patients that have these symptoms. So if you are having those symptoms, I would say, listen, you definitely should start taking an anti-inflammatory medication. What do I mean by that? Advil, Aleve. These are just some basic over-the-counter medications that you can take as they are prescribed on the bottles. If you have your own physician, I'll let you reach out to them and get additional information there. If you feel you have some high blood pressure or kidney problem, you might need to get that addressed as well. But these can help. And those medications are different than acetaminophen or Tylenol. So Tylenol is not an anti-inflammatory medication. A lot of people make that mistake. You're going to get more relief from one of these anti-inflammatory meds. And you do need to stay on them for a reasonable period of time. Some people, when they take them for long periods of time, will develop stomach irritation. We call that gastritis. They can even develop stomach ulcers. So that's bad. You don't want that, because that'll cause other issues. So if you start to have those symptoms, you're going to want to stop taking that medication. If those medications, simple over-the-counter medications, are not working, there are some higher dosage, prescription grade anti-inflammatory medications that you could consider taking as well. You can ask your doctor about that. They don't always make a world of difference. Sometimes they do. When you see a pain management doctor, a physiatrist, or a spine surgeon, they may also consider recommending a short course of oral steroids. So, an oral steroid is another type of anti-inflammatory. This is a steroidal anti-inflammatory, as in a little different than a non-steroidal anti-inflammatory medication like Advil, okay? These medications, they are basically similar to a hormone that your adrenal gland produces called cortisol, that reduces systemic inflammation in your body. And we're basically giving you an extra dose of a similar type of hormone, okay? And so it can have other effects on different parts of your body. It can cause you to feel jittery. It can cause you to feel, have hyperphagia, which is really hungry. It can make you feel like invincible. Some people say they feel like Superman when they're on these medications. In elderly patients, on occasion, it can actually cause some untoward side effect like psychosis, which is unusual, but it can happen in the elderly population. It can cause people to have difficulty sleeping, increased heart rates, sweating. It even can sometimes cause you to have some swelling in your extremities. So there's a whole host of things that can happen with these medications. Most of them don't happen to most people. If you're diabetic, it can definitely bump your sugar, so you got to be careful with that, and you want to make sure to talk to your doctor about it before you get prescribed those medications. You can't get them over the counter, so you're going to need to get them from a doctor. That's one of the reasons why your doctor needs to prescribe them, because there's some risks to taking them. That being said, These doses, these oral doses, they're not really prescribed to treat just one part of your body, okay? Because you're taking them by mouth and go into your stomach, you digest them, and they basically go everywhere. In contrast, sometimes we will prescribe a specific type of a steroid injection. And so the difference between a steroid injection is you're basically going to get a much higher dose of the medication. And usually we inject that onto either a nerve around the spinal sac, or we think there's an irritation happening based on the images. Those medications, when injected on and around the nerves, basically give a local response and a higher dose right where your provider thinks that the pain is coming from. So they can last longer, they can have a higher dose, but usually that dose will actually leak out and ultimately get reabsorbed by your bloodstream, and then you end up getting the systemic dose as well. But it's a much higher dose and it kind of lasts a bit longer than the oral dose does. All of these medications, remember, they're really built to reduce inflammation, reduce symptoms, and make life more livable for you. They don't actually fix the problem, okay? And some people say, well, that's just a Band-Aid. I don't want an injection. I don't want to take steroids. I don't want to take those medications. They're not going to fix the problem. The point is that sometimes we just need to give your body some time to do the healing that it can do and let the inflammation reduce so that you can hopefully withdraw from the pain that you're experiencing. And that's one of the steps to kind of fixing or allowing your body to do its natural healing to whatever injury that has happened in your spine.